It's frustrating because you make an effort to see specialists, which doesn't happen overnight. It usually, for me, involves travel, and then you make all the arrangements, which are usually months ahead. You have to see sometimes in the same location, sometimes in different locations in the same city. And you realize that after an hour and a half with your mouth open, the prosthodontist says, I cannot find a driver to undo your teeth, to expose your implant. To have a deep clean every 2 years or 3 years, you actually need to remove the tooth that's sitting on top of this implant stem to get in around the edges of the implant. And it can be done with it on, but you cannot get the right angle so you can get in all around. And so there's always blind spot, which for the long-term health of your gum line and your implant needs to be exposed every now and then. And you get the prosthesis office, there is a little driver, it's a little screwdriver, but it's a specialist insert because there's so little tolerances that you can't use a normal screwdriver when there's a Phillip heads and stuff like this. You need a specific, and over the years there have been so many different manufacturers of these implants that, and I have 2 different types of implants because of the risk of failure in those days. We went half, so I have a double worry of having different implants mix and match, create a degree of redundancy and not total failure. Yep. So when I go there, they can get my upper bridge off, and then they say, sorry, we can't get you lower out. All they're saying is, oh, I used the wrong driver in the top, and now I have to repair the screw that holds everything in place. And so you sit there and the gentleman, the professional goes, sorry, I can't get this out. I can't find a driver. I've got my entire arsenal of drivers. I can't do it. You ask them and saying, if you had my records of which implants I had and what type of driver it is, and you had this beforehand, could you have avoided this problem this morning or this afternoon while I've had my mouth open for an hour and a half? And they said, yes.